because we're sort of on a time crunch since we only have the room for about an hour. So I want to thank everyone for coming, and I want to begin by acknowledging that we're gathering here today on Treaty 6 territory in the homeland of the Métis. My name's Allison Micha, and I'm the coordinator of the Saskatchewan Indigenous Mentorship Network, and we're one of the co-hosts of this lecture series. And Erin's going to introduce that a little bit more.
So good afternoon. Thanks everyone for being here. My name is Erin Wolfson, and I'm the Community Engagement Specialist with the College of Medicine. And as Allison mentioned, this is a partnership with a bunch of different folks, and this is actually the launch of our Indigenous Health Series, which we're very excited about, which is a monthly event that we'll be hosting here in this very room. So the partners for this are the Division of Sustainability in the College of Medicine, the Aboriginal Admission Program, the Saskatchewan Indigenous Mentorship Network, and the Department of Indigenous Studies in the College of Art and Science.
Sure. And I'm just going to have Dr. Ennis, come up and introduce Dr. Johnson Jennings. Oh, one more thing.
Sorry, just before we do that, I just wanted to mention, it's not on the slides anymore, but as you will have seen when you walked in, our next talk is taking place on November 21st, again right here in this room by Dr. Holly Graham. There will be a sign-in sheet that we'll pass around, so please do fill that out so that we can keep connected with you about future events. We also invite you as participants to keep the conversation going, so feel free to send us your questions or comments and reflections about anything you've heard here today. And lastly, I'll just mention that we are recording this session, and as well we have people joining us with WebEx. And if there's any concerns about that or any questions, feel free to talk with us at the end. Thanks.
And our next session will also be on WebEx, so if you're not able to be here in person, you can join remotely, and we'll share that link as well. So if Dr. Ennis, you want to come up and introduce Michelle.
Tanse, Kisinyu, Omechewin, Keheu, Nigasan, Kausas First Nation, Ochinia. My name's Rob Innes. I'm a member of Kausas First Nation and a department member and department head of the Department of Indigenous Studies. And it is my pleasure to be able to introduce to you Dr. Michelle Johnson Jennings, who is a member of our department. Dr. Jennings is a member of the Choctaw Nation, serves as the Canadian Research Chair nominee in the Indigenous Community Engaged Research and an associate professor in Indigenous Studies and associate in Community Health and epidemiology in medicine. I always have a problem with that word. Over the years, Dr. Johnson Jennings has partnered with multiple international and national Indigenous nations, organizations, and communities to prevent both substance use and food addictions, obesity risks. To do so, she has co-developed health interventions entrenched in ancestral guidelines to encourage a renewed commitment to health and revitalization of medicine, food, and land-based practices. Her research endeavors span the globe, from founding and formerly directing the Research for Indigenous Community Health Center at the University of Minnesota to recently completing a U.S. Fulbright Scholar Award to conduct research in New Zealand. Dr. Johnson Jennings received her PhD from the University of Wisconsin-Madison in counseling psychology and a master's from Harvard University in human development and psychology and contemporary Native issues. She has taught courses in Indigenous health, global Indigenous health, and Indigenous psychology. Dr. Johnson Jennings' therapeutic expertise lies in working with Indigenous communities and decolonizing healing while transforming narratives of trauma. She also serves on several international and national advisory committees, mentors students in several countries, and is honored to be the mother of 4 amazing children. Dr. Johnson Jennings.
Halito, so Michelle Johnson Jennings, Mita Haina, Inki Shokopona, Chakta Seo Hoke. So thank you very much for that lovely welcome. And I want to talk to you a little bit more about the kind of work that I do today. Today I've entitled Chash, Micha, Hollo. And I'll talk more about what that means. But basically I'm going to discuss some community projects that I've had around historical trauma and transforming those narratives into ones of health. So I also just want to pay my respects to the peoples of these lands. Allison did a wonderful job of doing so as well. But I also want to acknowledge that as we enter this space and this room, that I carry with me my ancestors from my Choctaw Nation who are greeting the ancestors of this land and your ancestors at this moment as well. So I want to recognize all of our ancestors in this location, within this space of the homelands of the First Nations and the Métis, as well from Treaty 6. And ask for their permission to speak today, and especially about Choctaw things and Cree territory and Métis territory, right? So I have some degrees, and I've been doing this work for a little while as a clinical health psychologist, but really who I am is a Choctaw Indigenous woman. And I'm going to be speaking to you today from that perspective. As you can see up in front of you, we have some photos of Choctaw women from yesteryear, actually from Louisiana area. Upon first contact, there are some sketches of them with our tattoos that we used to have across the face. We also have some of an image of our traditional homelands in which we would build our homes upon mounds. So as a kid, I would grow up and people would ask me if we lived in teepees. And I have to explain to them, no, we never did. We always had homes, wooden homes that we lived in. And then also you'll see an older image. Again, this is non-Indigenous, but an older image of stickball players. And I like to use this painting because it illustrates that not just Choctaws engaged in stickball, right? Or we call it ishtaboli. We like to say we were the first ones, but I think many other tribes do. And at the same time, we also had some grand games across Turtle Island, up into Canada, the U.S., down to Mexico, playing different ball games with them. So we've always been connected to one another and traveling around quite a bit. And we still continue these ball games today. So you'll see some of our Choctaw Nation youth. This is my tribal territory and homelands. Our mountains in the background. They're smaller mountains, but mountains, and a few more trees than there are here. And then up in the corner is my Pokney, my grandmother and myself, who is a great source of inspiration. Now, I also show you my lands because we do we do a lot of work with the tribal communities I work with. We focus on land-based healing. And land-based healing can be really useful when we're talking about trauma. Let me see here. Clicker. Perfect, even better. All right. So transforming trauma. A lot of our trauma goes back historically quite a ways. With Indigenous people, a lot of people say it came upon contact with Europeans, right? Mass trauma, mass deaths, mass disease hit our nations. And this trauma, many argue, especially within research, we've seen that there's effects that affect our health today. And from a Choctaw perspective, when working with trauma, we often use the term of Chash. And Chash kind of sounds like almost like a cuss word, I guess, but it's actually calling upon your ancestors for help, right? So some people would say, oh my God, I suppose. And then for Choctaws, we would say, Chash. Call upon the ancestors to help us in this moment. And with calling upon the ancestors, there is a belief that through the ancestral knowledge, there are original instructions that were imparted and gifted to the Choctaws that help us today and to handle trauma and to help be resilient and move forward and flourish, even though trauma has occurred. Now, to give you kind of a framework of this view of land and how it can be healing, I'm going to tell you a story. I'm going to try to be brief because I know we don't have a lot of time. I see my husband over there kind of rolls his eyes. But as Choctaws, we often tell stories. And a long time ago, the Choctaws were in the dark. They lived in this land that they actually had some corn gifted to them already. So they had some sacred food that they built their ceremonies around. And things were okay, but they were a little depressed and not a lot of things happened. And one day, out of the west, this raven, this Falah, came through to the community. And it came through and said, Falah, 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 follow me, follow me. I found a place with light. It's beautiful. It's wonderful. You're going to love it. It's warm. You'll love it, Choctaws. Follow me, follow me. And so the people stopped and they looked around. The 7 grandmothers who led our council said, we'll talk about it. We'll figure it out. So they met. And the grandmothers debated, well, should we follow Falah? We don't know if Falah knows what he's talking about. Who knows where we'll end up? And another grandmother said, well, yeah, but as Choctaws, we've been kind of depressed lately. Maybe lack of vitamin D. Maybe this other land will have that for us. I don't know. I said, well, okay, maybe it is time to move on. So they went to their sacred mounds, they gathered the bones of their ancestors, and they carefully removed them and boxed them up. The able adults put them on their backs, as many as they could carry. The other family members did as well. They lined up the elders in the front with the children, and everyone else went in the back. And they told Falah, we'll follow you. So for many moons they followed Falah. Falah would come through, Falah, this way, not too much further, not too much further. And so the Choctaws would march on and on and on. And finally, when they thought they couldn't handle it anymore, Falah said, it's here. It's a place where you go to the other world. So the Choctaws got behind and said, this is great. So the grandmother started going through, and I think today we call it a wormhole. The Choctaws have certain spots all across Turtle Island where these points occurred. So they went through. And the next person said, what did you see? What did you see? And the person calls back, it's beautiful. It's wonderful. You can't believe how great it is. The fire's in the sky. This place is amazing. Hurry. Tishba. And so then the next person went through. And then people were kind of craning their necks and trying to get in, like, hurry, Tishba, get through. Well, all the while, they didn't notice this whole way that they were traveling. These shoshi, these ants were carrying their sacred corn seed with them that whole way. They said, all those Choctaws have forgotten their sacred corn. They'll never make it in the other world without it. So they took it upon themselves to carry it for them. Well, they're there, and the Choctaws are there, and people start kind of pushing and shoving, and the grandmas get through, and the little ones are calling back, Mama, Dada, come on, it's wonderful, hurry up. So the parents are anxious to see if their kids are okay, and they start pushing a little more. Then all of a sudden they push an elder down. Hush to Lee, who's seeing this, says, this is terrible, those Choctaws. Look at them just pushing and shoving. Then they're still doing it, some more, and then a child gets pushed down. Hush to Lee says, this is horrible, those Choctaws. They're not even paying attention. They're not taking care of each other. And then before you know it, one of those Choctaws steps on one of those poor ants who's carrying the seed for them. Well, Hush to Lee is just astounded. How could they step on that poor shoshi who carried that seed for them all that way? And then another Choctaw stepped on one. And Hush to Lee finally said, I've had enough. The next Choctaw that steps on an ant becomes one. So the line got very short. The Choctaws all got through. And there are a lot of ants that came through with them to this other world. So I tell you the story of how we arrived in Holitapa Ishki, or a sacred mother, for several reasons. For one, it creates space for us as Indigenous people in this room, especially within an academic setting. And then for two, it also tells you about the Indigenous health framework, right? That for Choctaws, ancestors have the instructions for health. Within that story, there's embedded instructions about how we live. It's just not stories that we tell to our children. Although I do tell it to my children, they know not to step on an ant, right? There's still a lot more embedded within that. We know that within that, we are supposed to take care of each other. We know that our grandmothers, who were a matrilineal tribe, they still make the decisions in our families, our households, our communities, not necessarily at the political level, now it's been morphed into something else, but they still serve a vital and a critical role for us. And we follow their wisdom. We also know that we have an interrelationship with nature. We came to Mother Earth through a mound, and we are in this spot and grateful to be here. She is our mother that we have a responsibility to, just like we have a responsibility down to the insects who help bring our sacred medicine with us, right? We also know that with that sacred medicine and those gifts that we have, that if we abuse them, they turn back and harm us. So same with tobacco. If we misuse our sacred medicine of tobacco, it can give us lung cancer, it could give us breathing difficulties. If we misuse our foods and overeat, we know that we can get disease that'll afflict us later on in life, right? So we have to be careful with our sacred medicines that we're gifted and treat them responsibly and keep that relationship strong. We also know that when we're ill, that it arises out of imbalances. We start pushing and shoving people, right, to get to the front or to get through, that we're going to have harm befall us. We're going to get sick. If you're sick, it could be that you've offended one of your relatives and you haven't worked that through yet. So as Choctaw, we're very aware of that. If you've argued with someone, that can affect you physically. Just as if you mistreated the Mother Earth, if you mistreated animals, if you mistreated our other relations, you also may fall ill. And within that story, there's a brief mention in the longer version of spirituality, right? A focus on future ancestors. The elders went through to guide the future ancestors through first to the new world. So our focus is usually on multiple generations ahead. A lot of people say 7 generations forward. Anything that we do today, we know we're affecting the future. Any way I treat my body today, or before I give birth to my children, or what have you, I'll affect the future generations. Now, this is different. My being a clinical health psychologist, I've been trained in this Western framework as well, and in different methods that have a different notion of health and well-being, right? So it's not that your ancestors have instructions for health, but your ancestors have diseases they passed on to you, right? Who in your family has this disease? What have they done to you? That's kind of the framework when I start interviewing people when they come into a primary care clinic. Well, your grandparents have cancer. Oh, okay, they have cancer. They may have given that to you, right? Instead of focusing on what have your ancestors passed on to you to keep you healthy today. Also, of course, there's the distinction between mind, body, spirit, and nature. What happens in nature doesn't necessarily affect our mind, body, or spirit from a Western framework. We also like to isolate those healing compounds, right? We like to say, if you're suffering from a bacterial infection, if I give you this antibiotic, doesn't matter what I believe, doesn't matter what you believe, you should get better with this antibiotic. Whereas we know from even the Western placebo research, that's not the case. If the patient doesn't believe in the medicine, even if the provider has less belief in that medicine, it will be less effective, down to a 0 effect if the patient does not believe at all in that antibiotic, right? So our mind and our beliefs have a lot of power over our healing capability. So when we're writing grants, especially for some of the projects we do, we're often asked, what does land have to do with health, right? So you have to be able to answer that from an Indigenous perspective, but also from a perspective in which Western medicine and those reviewing your grants or your projects can understand it. And we know from a lot of the research that it increases our cognitive dissonance, right? So when I say that when we develop a project where we go outside into nature, we open up our mind in a way that's not usually possible when we're inside. So you may have experienced this yourself. You take 20 minutes to go walk outside under the trees in the forest, even just on, out on the prairie, you're going to notice a difference within your brain waves. There's actually differences that occur within your brain waves when you touch a tree, right? So it's kind of cool research because you think about tree huggers and other people who have talked about this going on throughout the years, but there's a lot of science to back this up now. We also know that going outside, even for 20 minutes a day in an inpatient hospital, from those who are clinically depressed and suffering, if they go outside 20 minutes a day, they have a huge difference in lowering those depression scores and feeling much better. So part of their treatment can just be going outside and getting out in nature. Part of all of our treatment can be going outside, right? No matter what the weather, just getting outside is really important. It also increases the mind-altering chemicals within the brain. It gets us back in touch with Mother Earth, though, as well. So especially for Indigenous people, going outside and touching the soil, not only do we know there's chemical differences that occur within the body when we actually touch soil with our bare feet or with our hands in the garden, but we know that we're reconnecting with our mother at that point. So you're reconnecting, and perhaps there's knowledge being transmitted through that we're not even aware of. And in that way, we can remember our ancestral ways of healing. Now, the work I've done specifically with the Choctaw Nation, that I'll talk about a little bit more, and with the United Homa Nation, really focuses on reclaiming and following the path of our ancestors. So a lot of times, even with other tribal communities in the states that I've worked with, they will want to do a land-based healing project, but will say, but we don't really remember what our ancestors did. We don't really know what practices they had in mind, so we're not really sure how to move forward. And this is where it can be really fun as a researcher coming in, because we do a lot of archival work. We go back, we look at oral narratives, historical oral narratives from tribal members, and see what kind of stories are there. And we glean from all that information, then we start to put forward, have you ever heard this story? Have you ever heard of this? And then people inevitably will say, oh yeah, I heard a version of that in my family. And some other family over here will say, oh yeah, I've heard that too. And so when we start to think about reclaiming or following the paths of our ancestors, it usually takes just people coming together from different families who usually don't talk about these things. And then out of that mixture and discussions, we'll have a beginnings of a framework around original instructions for health and well-being. I've been in communities before where people said, oh, you know, you talk about all this health stuff, but I'm here to tell you, I don't want my child getting skinny. So, you know, when you talk about eating healthy, I want my grandson to be a nice, healthy boy, right? I want him to be able to survive if he needs to. Say, oh, that's an interesting point. Yes. You know, as a mother, I had the exact same feelings. My eldest baby, she came out, she was nice and plump. I had little rolls of fat, and I was like so proud of her. And as she grew, I was so proud that she was so big, and this is great. Then my next baby wasn't. I was like, oh, what's wrong with her? And then my third baby was even skinnier. I thought, oh, this is terrible. So I take them into the physician. I'm like, they're so skinny. I don't know. I feed them. They're not getting any bigger. I don't know what's going on. And the physician's like, they're well within the normal weight range, right? Like, this is how they're supposed to be. This is healthy. This is okay. And even myself, being a trained clinical health psychologist, especially around obesity, I know this on one hand. But on the other hand, there's this internal drive, this instinct to want to have a large baby to make it through a famine, right? So with our communities, I talk about this. I say, well, what does that come from? Is that from our original instructions to feed your baby and make sure they're healthy? Or is that a reaction to colonization, right? Is that a reaction to trauma? And so when we talk about original instructions and our stories around being healthy, there's a need to differentiate between reactions to trauma to survive, because yes, 50, 100 years ago, that baby would probably be more likely to survive in the conditions that we were living under, to now when we can go down the road and pick up $1 hamburger, right, even if we have lean times from McDonald's. So we need to differentiate what is a trauma reaction, and then what are the original instructions from our ancestors? And then we start talking about how can we augment those with Western practices only as appropriate. So in my work, I use a lot of motivational interviewing. I design health interventions drawing from motivational interviewing because it's how my grandma talked to me. She'll say, hey, have you ever thought about your cousin who's also doing what you're doing that I don't like? But not in so many words, right? Like, oh, yeah, well, what do you think about them changing that? Oh, well, I guess so. I guess I do it too, and maybe I should change too. Oh, okay, it's just back. But it's always this approach of discussing a topic. If you're comfortable, if you're not, you don't talk about it. And then going further and further and saying, okay, what can you do to make changes, right? So that, in my experience, has been really conducive to a lot of Indigenous ways of healing. Now, also within reclaiming, we need to focus on decolonizing, right? Indigenizing and decolonizing. So when we think about health intervention research, it's wonderful that we can start from a point of indigenize. I've been working with some colleagues of mine developing actually an article where we looked at our different projects across the United States, and we looked at what's similar, working with the original instructions, and what's different. And from this, we found some basic tenets. We said that indigenize building up from our Indigenous knowledge, worldviews, and practices, while decolonize is simultaneously dismantling internalized colonization, right? So that would be my own perception that I need a nice, large, robust child, right? So I need to decolonize that view even within myself to say it's okay for my baby to be healthy where they are right now. We also need to not only decolonize the mind, but the body, spirit, and heart, right? Our thoughts, behaviors, and feelings. How do we get back to that place of our ancestors and their teachings about how we should treat one another in our community? How should we take care of one another? And in doing so, Indigenous communities must be in control for this, right? So you can't engage a community and say we're going to indigenize and decolonize, and this is what we're going to do. It has to be the Indigenous community that you're working with developing this. And they must be in control throughout the whole process. So with original instructions, a lot of times people wonder, well, what does that mean, original instructions? Are you going back to what's considered traditional? Traditional knowledge, traditional practices, traditional food. And I work a lot with my husband, Dr. Derek Jennings, and we talk about traditional can still be colonized, right? It could be a reaction to colonization. It's traditional for us to bring Kool-Aid to a ceremony. Okay. Well, that could be considered traditional food, or it could be considered a reaction to colonization, what's available at the time with the means that they had available to supply at the feast. What are our original instructions around feasting or ceremony? And again, Dr. Jennings can go more into this, more of his line of research, but we talk about what are our original instructions around, what did our ancestors say we should do, and what is the rationale behind doing that, right? Because there are certain things that we follow, and it's good to start to question, okay, is that original instruction, or for myself personally, or is it something that I just do because I was told to do, and now I got to figure out where does this come from? And so when I've been working with my own tribal community, that's been really important. Now when I work with other tribal communities, they do that for themselves. They sit and we'll discuss in focus groups about what is an original instruction, and then what is a form of colonization that we've incorporated as traditionalism. Trauma plays, again, a large role in disrupting the original instructions that we were gifted. We were gifted these instructions from our ancestors, from Creator, from the spirit world, what have you. And this is a painting of our corn woman. And a lot of times we forget the stories, right? We forget what's been passed on if we don't get together and revitalize those. And in the process, we're disrupted from our connection to Mother Earth and ceremony. So it's this historical trauma that's occurred to large masses of people that can affect future generations. In fact, we can see the effect, right? Even in other communities, such as the Dutch famine, right? We know that the offspring from those who experienced the Dutch famine, they have higher rates of chronic disease, they have higher cardiovascular risks, they have higher obesity rates, they have higher addiction rates, right? So we can see all of this. Any community or society that's experienced a historical trauma, we can see that it affects the health for generations afterwards. I worked with one individual who unfortunately never published it, but said they saw the same effect even in mice. They said when they had one mouse go under trauma, 7 generations later, the other mice had ill health effects, right? They're very excited. We're like, publish it, publish it. And unfortunately, I don't think it's ever been published yet. But there is definitely something there about experiencing trauma. It affects us down to our cellular level. So it's not that it affects just the parental relationships. It affects how one learns how to be a parent or learns not to be a parent or learns how to interact with society, but it affects ourselves. So as you know, we've had a lot of land trauma in Turtle Island. We've had large groups of Indigenous people all across that we used to interact, we used to know, we used to speak with. Choctaws were renowned for knowing 15 different languages, right? So we always interacted, especially up and down the, river systems. We always interacted with one another. Mexico, Canada, U.S., definitely engaged. And then through colonization, especially for the U.S., our land use was greatly restricted and we were removed from those sacred lands. And when we're removed from a sacred land, we're removed from those original instructions linked to that sacred land. So we can no longer heal ourselves the way that we were instructed to heal ourselves. And so I would argue there's a large time period in which there was a lot of trauma that occurred, trauma after trauma after trauma. And what we know from the research is the more trauma you have, including if you have historical trauma, and then you have childhood trauma, and then you have other trauma in your life, the more of an impact it has on your health and well-being. So it's not just, oh, someone had historical trauma and they're fine. It's how much trauma has this one person incurred today? Because every time you experience those traumas, it accumulates, right? And not only does it accumulate in them, it gets passed on to their offspring as well in different ways. And I have a list of, in the States, anyways, we've had a lot of historical health trauma. A legalization of traditional healing practices. Our health was handled by the Department of War. I mean, that's a big indicator right there, right? We've had the Trail of Tears, where we had large removal again, and the Choctaw Nation was the first one to be removed in 1830. They were forced to sign a treaty. to be removed from their homelands into Oklahoma, where 60 other tribes now reside. So they've all been moved and reduced down to this area from all the way from New York to the West Coast, to even up in Canadian area territory, all the way down to Oklahoma, which is quite far. And of course, forced sterilizations continue to be a problem. We know for a fact that they were occurring until the 1990s, and it affected my families. It affected a lot of families in Oklahoma of being either going in for a C-section, no longer having a uterus, or being told, oh, you can do a womb transplant later, so let's just take it out now. You'll be great. And so they'll take out their uterus and with false information. So again, just, it affects our cells. And so when we think about these intergenerational effects, we also want to think about how can we counteract those effects, right? Because it can be very gloomy and overwhelming to think, well, we have all this trauma and all this stuff I was raised with. How can we possibly create a better community when you have all this to deal with? But I also want to bring up, not only is trauma passed on, but intense emotions such as love is passed on, right? So though I may have had a grandmother who hated, I'm trying to think of a food I just absolutely hate. Well, I don't really like zucchini. So maybe I had a grandmother who hated zucchini. Maybe she was traumatized when she had a piece of zucchini. And they've seen this in my studies as well, right? That you can actually pass on this fear of a certain food or distaste of a food if you traumatize the mouse for the subsequent generations. And so maybe my grandmother hated it. And then I don't like zucchini because of it. But maybe also my grandmother experienced intense love of a tree, of a flower, of a person, of a song. And then when I hear that song, there's no reason why I wouldn't also have that ancestral memory, right? So as we think about trauma, I want to encourage you to think, at the same time that there was trauma, there was deep, unremitting love at all accounts within Indigenous communities. And that was also passed on. Now, I talked about this, so I'm not going to belabor the point, but, why does this revitalization matter? And why does it matter to transform those narratives of trauma into one of love? And we know from the research that, of course, we're going to have a lot of problems if we have historical trauma, present trauma. It's going to affect us in a variety of ways and increase our addiction risks and our food addiction risk. I mean, that's pretty well established within the literature, right? And then we also know, though, from twin studies that if you're put into a loving parent environment and before the age of 5, so you have 2 twins, one goes to a less loving home, one goes to a more loving home. The one who went to the less loving home still has the same addiction risks based on the mother who was pregnant having incurred trauma. So it's the CYP2D6 allele, basically. So it's just a phenotypic expression that arises, but makes them more at risk, right? And so, but then the other twin who went to this loving parental home actually no longer has the risk, right? So we know that love can transform not only how we perceive the world and our behavioral acts, but a loving parental home can transform our very genes. And this is amazing. Right? This is wonderful. This is what our ancestors taught us. As a Choctaw person, we knew children were extremely important. You don't yell at them. You don't hurt them. You gently guide them and love them. The community guides and loves them. You definitely don't push them down, right? Trying to get through the mound. You take care of those kids. And the reason you do is because our ancestors knew we were incurring trauma and the different trauma would happen. But yet, if we loved our children and transmitted that, we could protect them. So the work that I do is that we look at doing that even among adults, teenagers and adults, right? So if it happens with children, we may not be able to completely change the genetic expression by age 20 or 30 or 40, but perhaps through reconnecting through our traditional ways and medicines, we can also reduce the risks. And the research is showing that that is possible. So like I said, I've worked with my own tribe, the Choctaw Nation. We've developed a National Institute of Health funded RO1 study. They call it a multi-million-dollar grant. And it took a lot of years in the planning. We've been working for at least 7 years on this. And basically the tribe called us down and said, the health director said, we need to do something about these diabetes rates. The tribe is going to have children who die before their parents by 2020. So our obesity and diabetes rates are off the charts. And I was with Dr. Karina Walters at the same time, and she and I are like, well, what can we do? We're here. We'll do something. And we're thinking, we'll do some kind of diabetes intervention. We'll work with people. So, well, we want you to do something around the trail, the Trail of Tears. And so the removal route that plays Choctaws in Oklahoma today. And for Choctaws in a lot of tribal communities, memorial walks are very popular. Throughout our history, thousands of years ago, even we would do memorial walks to learn, to revisit, and to remember the teachings from those walks, right? So we said, okay, we'll do something. And they said, well, you have a couple of months to do it. And I'll talk also about the United Homa Nation after that. But you can see these are our routes here. And, there we go. Okay, so the Choctaw were actually all within this area. And I'm Choctaw, so I'm going to probably say it's a little bigger than it actually was. But we started, my people were more in Alba-Oma, or Alabama. So this is the place where you gather the sacred medicines, is what that means in Choctaw. And we were removed first to here, where we had to all gather. And also from up here, they had to come down. And then they put us on 3 different waves, marching us into Oklahoma. And so these could be thousands of miles that people traveled, right? I think this from here to here could be 500. And so our tribe said, design some project around this. Like, okay, great, we'll do that. So we got together and figured out, well, we would want to walk the exact routes of our ancestors. We want to be in their footprints. We want to get back in touch with Mother Earth and the land to remember those original instructions that kept us healthy and well. And I had worked at the Western History Collection at the University of Oklahoma as an undergrad, and I remember reading the letters of those who were on the walk, right? Because they would write in, or the journalists would come and interview them while everyone was dying and it was mass chaos. But they would write, and every time the ancestors would talk about, we are walking this walk today so that our future generations can be healthy, so they can be Choctaw, so they can be who we want to be. Because in theory, if you didn't want to go on the walk, the government said, you could stay in Mississippi if you wanted to, and, but you couldn't be Choctaw anymore. Well, to our people, that's not acceptable, right? There was a group that did stay in Mississippi. They eventually were run down into the swamps, or the Mississippi Choctaws now. But our Choctaws said, no, we're going to all go. And they dressed in their funeral clothes because they knew it was going to be a march of death. And they walked. And when they were interviewed as well, our chief Nitikecha said it was a trail of tears. And that's where that phrase came from. You could see, you knew we were traveling through because of the wolves and they say the buzzards that would follow us because of all the tens of thousands of deaths. And they marched in the wintertime. They marched, you weren't allowed to bring anything with you. They wore through their moccasins and marched barefoot on ice and snow. They also ended up going, the second time they went when it was warmer weather, but it ended up flooding everywhere. So they had to march through swamps up to their waist with cholera and dysentery the entire time. So at no point was it an easier walk, or were there less casualties, I would say, on the 3 waves. But at the same time, like I said, the ancestors continually talked about walking with love for the future generations. So as we thought about this, we thought, okay, we'll design a wilderness experience therapy project. We're going to go out, we're going to camp, we're going to pack up every night, walk along the trail, re-situate our camp. And the first time we went, we did about 20 miles a day sometimes in 40 plus degrees Celsius weather. And it was that way because our tribe said, do it now. And we want it done before this, before the fall. And we said, okay. We had a hard time recruiting for that pilot walk. So we ended up taking my eldest daughter with me on that one. And a lot of the people who were involved today, who are now our staff, also volunteered as Choctaws on the walk. We learned a lot around that walk. We actually developed a Choctaw Health Framework, and our guiding questions were, what kind of ancestor did my ancestors envision me to be? What kind of ancestor do I want to be? And what kind of ancestor do I want or envision future generations to be? And through these questions, we were able to develop a curriculum for our future projects. And we went a second time just to make sure we did it right with my middle daughter, so we didn't want to leave her out during the heat and walk. And again, confirmed some of the thoughts that we came up with being Choctaws across the land. Now, this is I can go more into our details of our research project, more into the nitty-gritty of our methodologies, but I just wanted to give you a brief overview of what we're kind of doing with the group, and we've had some great results so far. So my eldest daughter made a digital story, and if we had time, or if we have time, I'll show it to you. It's a couple of minutes long, but we focus a lot of our curriculum around instilling that responsibility for the future generations, and instilling the responsibility of being an ancestor. And we found that there's been qualitative research indicating that people do not want to engage in harmful behavior because they want to be seen as a good ancestor. And there's a lot of focus within our work around health promotion leadership. So as our women, we work with Choctaw women because we are matrilineal. We thought that was the most logical choice at first, is work with the women. So every year we take 20 women on the walk, 10 days out. They actually have groups beforehand and groups afterwards as well. But during the time, they're really there to explore what it means to them to be a Choctaw woman and what health means for them as a Choctaw person. And then what kind of good ancestor do they want to be? So we focus around those questions. And then we give them a little seed money to go back into the community as a health promotion leader and do a project. So we've had gardening projects occur in places of the Choctaw Nation where there is nowhere to garden or no food. In fact, some people have never tried fresh vegetables in their lives at age 20. They've also gone back and done running groups. It's so wonderful. I'm on a Facebook page with one of them, and they're always posting about getting together and running and walking, which was unheard of prior to these health leaders going out on the walk. They have talks that they give on trauma and decolonization now, where they go back to the communities and talk about how trauma has interfered with health and well-being and how they choose to be healthy today, among other things that they're doing. So it's been a fabulous experience over the last years. And this is just one quote from one of our participants during the first walk. And I think it really illustrates how getting back on the earth of where your ancestors walked can really reconnect you with the love of your ancestors, right? And so there's a transformation that's occurring within our group, and the women are transforming that narrative of trauma into one of hope, love, and resilience. And this has happened not only with the Choctaws, but again, I don't think I have time to go into it too much, but I could talk to you on the side more about the United Homo Nation, who's been doing the same work. We had the same results with them. And through transforming that trauma into love, it encourages people to get out and be more active and to promote a healthier community. So that's been really honoring to see, I think, as a researcher. Now, unfortunately, I don't think we have time for that. I just wanted to put up here, because a lot of you are in the health field, that when we're doing this work, we also develop health frameworks that are culturally appropriate, right? So we develop the core principles of working with the tribal community that they value and that they find important, and then we operate our research within these. So every research interaction we are held responsible by our cultural advisory committee, as well as a separate scientific advisory committee. So our tribe is large enough. We have Indigenous scientists, Choctaw scientists, that form an advisory committee for us. And then we have our community members, our knowledge keepers, our wisdom holders, who also serve an advisory role, and they oversee what we do. This is just one piece of some knowledge that's developed out of the work that we've done, and this is just a song that was developed on the walk. The first two lines are actually from our ancestors and what they sang when they walked, began the Trail of Tears, and then over the years we've added in the additional lines to bring it back to they're walking, they're weeping, but then in the end, we're loving and we're laughing, and so the women sing this as well as they walk. And you know what I think I will do, instead of going into the Homo Nation, since we're running a little short of time, I think I will go ahead and just show you my daughter's digital story. And one of the reasons is because it really summarizes the kind of impact you can have with doing a health intervention based on original instructions and listening to the youth. So our next project will actually be with the Choctaw youth. We hope we get funded this next year to engage youth each time.
When I first heard about the Yopley Walk.
Okay, not showing up there, so let me just see here. Is it there now? No. Huh. Oh, I may not be able to show it. Yeah, let me see here. No, it won't do it. Ah, yay! I think, people who have PhDs are the worst Luddites. It's like technology.
When I first heard about the Yopley Walk, I was thrilled. I had been researching and making school projects on the Trail of Tears since second grade. Being Choctaw, I've always wanted people to know that there were more than just one tribe that walked the trail. Having to tell people over and over that the Trail of Tears wasn't just a Cherokee thing. All tribes had their own, but to 5 tribes, it was recognized as the Trail of Tears. Even as the youngest on the walk, I want people to know about the Choctaws Trail. I want people to hear Trail of Tears and automatically think, oh yeah, the Choctaws walked that. I would never have thought I would have an opportunity to walk in the footsteps of my ancestors, discovering more about them and more about me. Even the smallest things, like every step, or every berry I picked, or every word I said or heard, made me want more and more to share my experience with the world. One spot we walked through was mystifying. Seeing the ground worn in by all the feet from the different tribes turned that I want into an I will show people what happened to my ancestors. I will show people why I'm standing here today with my family and tribes. I will show people what it means when I say I am American Indian. I will show everyone, no matter what has happened in the past to us or what happens in the future, we will always be here because we are strong, like the earth, the soil our ancestors have walked upon, the clouds they looked up at, the air they breathed on the trail they walked, because they wanted us to feel that soil in between our toes, see those clouds, breathe that air, knowing that they walked for us, the Choctaw, to be here today. But they also wanted the joy they see as they look down and dance and sing and laugh with us as we experience the trail on our own. We did that because there was love, joy, hope, and strength on the trail they walked. And there was the people who would come after them, not to thank them for the miles they walked, the pain they felt, but for the joy and the ground they wore in, and the thing we call family and love. It is because we are happy and we look back on our family and thank them for keeping the culture and keeping the love. And walking the trail has made me thankful for what they did and aware of what I will do.
So I forgot to say, she was 12 when she first went, and I had no say over this video at all or what photos she chose to use. That's great. So, her digital video, we took a lot of our health intervention curriculum material from, as well as we had a couple of other youths from our directors that were involved with this attend. And it was really an eye-opening experience about how we can facilitate change and health and well-being from just going out and being on the land. And the research indicates that also when you do health interventions out on the land, that they're more likely to be sustained changes over time, right? Especially for youth, but as well as for adults. So it's very important to remember that as we move forward with health interventions and think about health and well-being, that we think outside the box and that we allow for indigenization of those health interventions to occur, as well as decolonize our thoughts about what makes a randomized clinical trial, right? Because this is a randomized clinical trial that we've been funded for. And it looks very, very different than anything you would see in a regular hospital or medical clinic, but still has very robust science behind it. And we're really excited to be able to analyze more of our surveys, quantitative work, biometric data at the end to see what kind of effect that we had. And I think as well we need to remember that through transforming trauma into love and focusing on those interrelationships with each other, with the earth, with the plants, with the animals, with our family, with our ancestors, that we can really fulfill our responsibilities to be healthy, as well as work with other communities in achieving the health that they deserve. So, yokoke.